So what we're going to do is we're going to demonstrate how the pelvis dictates the position of the spine. And this is something that I actually do with all of my spine patients on day one, so that they can know how to alleviate some of their stress off of their low back. So basically what I do is I'm going to take the spine model here and I'm going to show from the side how the pelvis either goes forward and we're going to cause too much extension, or if it goes too far backward, maybe too much flexion. So we're going to use our guy here, Mr. Chris, one of our sports residents, and this is the way that I teach them how to move their pelvis in certain positions. So I'm going to take him back here and I'm just going to say, just go ahead and slump sit. And so as he slump sits, I'm going to put my hand in this position. This is in an excessive sitting position, so now he's putting all of his strain on the posterior elements. And then I'm going to stand up, or bring him forward, so I'm going to bring that pelvis forward. And then you can see now that he's in too much extension. And so what we really like is to see where he goes in, somewhere in between the middle. So I want him to be able to rock a little bit back and forth. But this really helps out, like if he's sitting in the car for a long time and then he has to get up and he's pretty stiff, let's go ahead and just have him just move just a little bit in his free range and pain-free range of motion. But he wants to make sure, I have to make sure that he's using this for function. So we don't want him sitting like this the whole time. If he's going to be too far anterior, we see this in standing, go ahead and stand up. And so he can put his hands on his hips right here, and he can kind of see right in here, so he's too much anterior, and then he comes back this way, maybe too much posterior. We like for him to be somewhere like right in the middle. So as he does this, like let's just say, I want you to keep your back straight, typical, keep your back straight and go ahead and have a seat. Okay, so now he has a great position there. But if we were to say, hey, I would just want you to keep your back straight, now go ahead and stand up, keeping your back straight, it's very difficult for him to do, right? So what I need for him to do is get in that pelvic position here. So he's going to kind of rock forward just a little bit, lean forward, and then go ahead and stand up.